The 3M Bair Hugger is used to provide warming therapy for patients in an effort to maintain a normothermic body temperature. It is often utilized for post-surgical patients, but at St. Mary Mercy Hospital, Livonia, it can also be used at the nurse's discretion, without a doctor's order, whenever a patient has a body temperature of 96.8 degrees Fahrenheit or less, complains of unrelieved coldness, or experiences continued shivering. The Bair Hugger can be used on patients on any unit throughout the hospital. To find one, call the nursing office. If one is not currently in the nursing office, you may need to call through other units to find one. Because these can be used anywhere, you could potentially find the machine on any nursing unit. The Bair Hugger unit is on a small rolling cart. The hose and power cord both remain attached to the machine at all times. To power on the machine, release the power cord from the fastener and plug it in. There is no on-off switch or button for this machine. The machine will turn on and run a quick self-diagnostic before placing itself in standby mode. Once the standby light is illuminated, the machine is ready for use. The Model 775 that is used at St. Mary Mercy Hospital has multiple airflow and temperature settings. The ambient setting will circulate room temperature air through the blanket. 32 degrees Celsius, or 89.6 degrees Fahrenheit, is your low setting. 38 degrees Celsius, or 100.4 degrees Fahrenheit, is the medium setting, and 43 degrees Celsius, or 109.4 degrees Fahrenheit, is the high setting. These temperatures are the temperature of the air coming from the machine, not the temperature of the patient. There is no thermometer probe attached to this device. You will be required to check your patient's temperature at least every hour using a standard thermometer to assess the efficacy of this treatment. Prior to initiating Bair Hugger therapy, you must document the patient's temperature in Epic. You also need to document the application of the Bair Hugger therapy in a nursing note. When a setting is selected, it may take a few minutes for the Bair Hugger to warm up and circulate air at that temperature. Once the temperature of the air entering the Bair Hugger blanket is within 1.5 degrees Celsius of the desired temp, the Temp in Range light will illuminate. You can see the actual air temperature at any given point on the small digital readout on the front of this machine. The device has two airflow settings. The top button, with the larger fan picture, is the high fan setting, and the button below will result in less airflow. The standby button will stop airflow, but the unit will remain powered on. Other lights on the unit include a fault light that indicates something is wrong with the machine, and an over-temp light that indicates the air temperature is above the desired setting. Along with the Bair Hugger unit, you will also need a Bair Hugger blanket. You can obtain one through the nursing office. These are individually packaged, one-patient use, non-sterile, disposable blankets. On the top of the blanket is a U-shaped opening. This is where the patient's head will be located. Near the opposite end of the blanket is a paper label with a circular opening. This is where you will insert the hose. The blanket has a shiny side and a matte side. The shiny side is actually covered in thin plastic tubes, and the matte side is perforated with many small holes all over its surface. Place the blanket shiny side up. The patient's head should fit within the U-shaped opening, with the blanket positioned on either side of the patient's face. You want to minimize the number of layers between the Bair Hugger blanket and the patient. You do not need to have anything more than the patient's gown between that blanket and the patient's skin. Insert the hose into the designated opening. Also attached to the hose is a sheet clip. Position the sheet clip so that the hose won't be able to be pulled off the bed. Since the blanket itself is very light, the weight of the hose can easily pull the blanket off the patient, so be sure to use this sheet clip every time. Power on the unit and choose a temperature setting. The blanket will inflate as air is pumped into it. The holes on the reverse side of the blanket will allow the warm air to escape towards the patient to more effectively bring their temperature up. You may put a standard blanket over the Bair Hugger blanket. This can help warm the patient faster, but also it is helpful in keeping the Bair Hugger blanket in place. Check your patient's temperature every 30 to 60 minutes and document it in Epic. When the patient's temperature reaches between 96.8 degrees Fahrenheit and 100.4 degrees Fahrenheit, turn off the warming blanket. Further warming could cause hyperthermia. Bair Hugger therapy is contraindicated in patients with ischemic limbs. Thermal burns could result if a Bair Hugger is used with these patients. Do not use the high setting of 43 degrees Celsius when treating patients with significant peripheral vascular disease, low cardiac output, total immobilization, or marginal cutaneous perfusion. When you are finished using the Bair Hugger, clean it thoroughly with an appropriate cleaning wipe, such as the gray or orange top wipes. Coil the power cord and attach it to the machine with the provided strap, and wrap the hose around the unit so that it does not touch the ground. If you are able to return it to the nursing administration office, it will be easier to find for the next patient that needs it.